What are we discussing today?
Something that reminds me of you sometimes.
This better be good.
Shouldn't be bad. I think you're like lymph nodes sometimes.
What? This doesn't sound like a compliment at all.
Why? I think you reminding me like lymph nodes sometimes is not a bad thing.
Why am I like lymph nodes to you sometimes?
Because sometimes I just want to take you out.
Ooh, okay, I like it. That wasn't too bad.
Not bad, eh?
So, we are going to talk about lymph nodes today then.
Yep. Let's talk about one of the most common reasons patients get referred to oncology, lymphadenopathy, or enlarged lymph nodes.
Where's my noodle?
No noodle today. We're in Boston right now. Next time.
Alright, guess we have to settle with the fin. Let's go.
Howdy folks, welcome to our channel. I am Pushy.
I'm Mushy.
And we're the Pushy Mushy. Yeah!
Serious.
So, B. serious is actually a gram-positive bacillus that has the potential to cause food poisoning.
Seriously.
We will do our best to combine facts with humor, but if we do make mistakes, please let us know and we will do our best to correct. Please like or dislike, hopefully not dislike, subscribe, comment, share, and press that bell icon.
Great. How did you say that word again?
Lymphadenopathy.
Lymphadenopathy. This means enlarged lymph nodes?
Correct.
Where can we find lymph nodes?
Many places. However, when we skip those places where we usually can't see or feel, we're left with a few. The neck, the outer chest, the armpits, the inner elbow, the groin, which I don't think you want to see. And
Cannot demonstrate.
yeah, I cannot demonstrate. And the back of the knees.
What causes the lymph nodes to enlarge?
There can be a lot of causes, and I don't see the point of memorizing all these causes. In most cases, lymph nodes get bigger in response to an infection, which can be caused by a lot of things, including bacteria and viruses. In rare cases, lymphadenopathy can be a sign of cancer or malignancy.
Is this last comment you just made the reason why many patients get referred to oncology?
Yep. However, most of the lymph nodes referred to oncology are actually not cancerous. In fact, the prevalence of malignancy in patients presenting with lymphadenopathy is estimated to be less than 5%.
5% still sounds scary.
The probability of malignancy or cancer increases with age. In younger populations, the probability can be less than 0.5%. I wouldn't remember these percentages. I'm simply providing these numbers so folks get a taste of what we're talking about. Again, most lymphadenopathy is not caused by cancer.
But cancer sounds scary.
It sure does. And therefore, for folks who do not have a medical background, or those of us with a medical background but worried for whatever reason, enlarged lymph nodes should prompt medical attention in a timely fashion.
Meaning heading into emergency room in the middle of the night?
Generally not. There are obviously exceptions, but lymphadenopathy can generally wait for one's primary care physician to coordinate for further care.
But what if it's cancer? By telling people they can wait, don't you feel like you're sort of implying to delay median diagnosis and care for potential cancer? What if our channel gets sued?
Mushy actually raises a great point.
I broke my fin.
You don't care anyway. First of all, my personality as a doctor is I don't sugarcoat things. Meaning, I always tell my patients the truth. I might often have to modify the way of delivering various truth to various patients and their families in order to be appropriate. But at the end of the day, I deliver truth.
If you have been watching our channel, you know Pushy pretty much asks folks with alarming symptoms to seek immediate medical attention regardless the time of the day. So I think he's telling the truth. More importantly, please don't sue him.
Yes, please don't sue me.
Continue on.
Actually, if you truly believe you should sue me, you should sue me.
What are you talking about?
I think folks have the right to do what they believe to be truly right. So if someone feels that suing me is the right thing to do, I think he or she should do it. Back to Mushy's question. In the rare cases of someone's lymphadenopathy actually being malignant or cancerous, the truth is that diagnosing this cancer right now versus a week later likely won't change someone's treatment course and or outcome. Obviously, I'm not God, so I can't guarantee everything, but in general, this is true for lymphadenopathy.
Actually, you cannot guarantee anything.
Actually, I can. I guarantee you're always an angel to me. Somebody call God! He's missing an angel!
Stop horsing around. But that guarantee was sweet. So, who can get lymphadenopathy?
Anyone, regardless of age, gender, and ethnicity.
There are certain things we can look for when we feel enlarged lymph nodes to potentially differentiate serious versus non-serious lymphadenopathy.
There are some general rules, but I want to emphasize that it is not a non-medical person's responsibility to distinguish between what is serious versus not serious. So, when in doubt, seek medical help.
What are these general rules?
There are 4 things one can keep in mind when assessing an enlarged lymph node.
Number 1.
Lymph nodes that rapidly increase in size are generally more dangerous.
Number 2.
Lymph nodes that are firm, hard, and immobile, meaning having a feeling of attached to the underlying tissue, are generally more dangerous.
Number 3.
Lymphadenopathy right above the clavicle or the collarbone can potentially be more dangerous.
And number 4.
Lymphadenopathy associated with constitutional symptoms or certain risk factors are generally more dangerous.
Medical jargon. What do constitutional symptoms mean?
I'm sorry. Constitutional symptoms are symptoms that affect an individual's well-being, usually referring to fever, chills, night sweats, weight loss, fatigue, and more.
And what sort of risk factors are we talking about here?
I wouldn't memorize these risk factors, but certain examples, such as neck lymphadenopathy in smokers or armpit lymphadenopathy in women, these cases of lymphadenopathy are generally more worrisome to me.
So, say someone's lymphadenopathy is worrisome. What diagnostic workup would a doctor usually do?
We usually start by obtaining a thorough and pertinent history, followed by physical exam. Sometimes no diagnostic workup is necessary, and the lymph nodes can simply be monitored. When diagnostic workup is actually necessary, we can potentially ask for both blood work and radiographic imaging.
For example, blood work looking for cat scratch disease or a CT scan looking for extent of lymphadenopathy.
Wow, wicked smart.
Of course, would the surgery be required?
Not all the time, but sometimes. When lymphadenopathy requires further workup, we might ask a surgeon to take it out for a biopsy. Therefore, to me, you're like an enlarged lymph node because I want to take you out sometimes.
That means most of the time I am reactive, meaning caused by some type of infection.
What the?
And very rarely I am cancerous.
I was just referring to the part that I wanted to take you out sometimes.
And you only want to take me out when I am a problem.
Okay, boss.
Apologize.
It's too late to apologize. It's too late. Okay, I'm sorry. So, to summarize, lymphadenopathy is generally not a big problem, but can be at times when you, your family, including your kiddos, have enlarged lymph nodes.
Do not panic because most of the time these lymph nodes are just simply reactive for an infection that is treatable.
Take a look at the enlarged lymph node.
Does it fit the 4 things that Pushy mentioned before? If so, seek medical help sooner than later.
When in doubt, get in touch with your primary care physician. But in general, lymphadenopathy is not something that needs to be looked at in the emergency room overnight.
However, if there are other concerning symptoms along with lymphadenopathy overnight, you might consider visiting the emergency room.
We're the Pushy Mushy. Thanks for watching.